Hi, my name is Dr. Tanwale. I'm here to answer your questions that you have posted on social media. Based on research, bad breath is actually caused by volatile sulfur compounds. It can be also classified into intraoral or extraoral causes of bad breath. Usually the ones that we deal with as a dentist is mostly the intraoral ones, which can be due to accumulation of bacteria on the tongue, or it could be from decay, abscesses, swellings in the mouth, things like that. Extraoral causes can be from, say, tonsillitis or chronic sinusitis. Other things could be poor digestion. The action of flossing in itself doesn't really strengthen the gums, but it does remove bacteria from the crevices around the teeth, which does then help strengthen the gums. Now, bleeding could be from two causes. One, it could be from trauma, which means you're flossing the wrong way and you're just really traumatizing the gums. Or it could be that there's a sign of disease. So if you're flossing correctly and you're not traumatizing the gums and they're still bleeding, then it might be an early indication of gum disease. Look, polishing your teeth in itself means that it's a more generalized clean. So it's mostly cleaning above the gums, polishing the teeth, making sure the stains are removed. So if you have healthy gums and teeth, a regular polishing and scaling does help. However, if you do have underlying gum disease, a regular scaling and polishing may not completely eradicate or stop the disease. That's the most important question most coffee drinkers have. Like I said, it's always the love between having bright teeth and the struggles of having stained teeth. So at the end of the day, if you're going to have a cup of coffee, maybe just rinse out with a glass of water. That might reduce the amount of stains on your teeth. If you want to have a quick brush, just for the extra freshness, I would say wait half an hour after consumption of the coffee before you give it a quick brush. So the white spots, I guess, that you see on the front teeth, especially if you've got a history of trauma, can be due to malformations of the crystallite structure of the tooth itself. This can be due to the trauma. It could also be from malnutrition. So in any case, as long as there's no actual decay occurring over it, it's not a big deal. But there are a lot of patients who are very disturbed by the aesthetic look. And if you've got something important happening like a wedding or something, I can imagine how much that would affect you more. But at the end of the day, there are solutions to it. I'll go through a couple, one of them being what we call microabrasion infiltration therapy, which is where we remove actually a very small layer of the top surface of the tooth and infiltrate a resin material in, and that would actually change the optical properties of the tooth and make it look less white and patchy. Of course, where it's very severe, sometimes you would probably need more invasive treatment like veneers, crowns, things like that, or even just a small filling.